Hello, my name is Dr. Ibi. I welcome you once again to this channel, Beyond the Consulting Room, where I talk about issues that concern your human dignity and well-being. In this video, I want to talk about how you can manage your weight, and we can look at this from two angles. There are people who are trying to gain weight. They are underweight and they are trying to gain some weight so they can be within the normal ranges. Then there are people also who are obese and then they are trying to reduce weight so they can be within the normal ranges. So what are these normal ranges? Well, we classify people as being underweight, being within normal weight, being overweight, or being obese according to their BMI. BMI is your body mass index and it's calculated by dividing your weight in kilograms by your height in meters squared. Okay, so when your BMI is below 18.5 kg per meter squared, then we say that you are underweight. If your BMI is between 18.5 to 24.9, we say you are within normal range. If your BMI is 25 to 29.9 kg per meter squared, we say you are overweight. If your BMI is 30 and above, we say that you are obese. All right. Sometimes also we use your waist circumference. So you can measure your waist circumference. You are trying to look at your abdominal fats. Okay. So you can measure it, your waist circumference around on top of your hip bones, around your belly button. If you are female, we don't want that to go above 35 inches. If you are male, you don't want your waist circumference to be about 40 inches. We believe that your risk for having some diseases, especially the cardiovascular diseases, your risk can be increased if your abdominal fat is beyond certain ranges. Okay. Even though we say that when we're talking about weight management, we are interested in people who are trying to gain weight because they are underweight and people who are trying to lose weight because they are overweight or obese. My concentration will be more on those who are trying to lose weight. It's because when we come to health-related issues, we see that more in those people, and also because of the body image issues that confront people who are overweight and obese. Okay, so I'll concentrate more on these groups. But I need to make some clarification. The first one is that there are people who have tried so hard to lose weight. And so they've tried diet and exercise. And because of that, and because they've tried so hard and it's not working to their satisfaction, some go for some weight loss products or medications for something for a quick fix approach. I would advise that you have to be careful because when it comes to weight loss products, we medical practitioners are very skeptical, and there are only very few approved products that we can use for you or on you. Okay, so be very careful with weight loss products, especially the ones that promise to be natural products. Okay, then a second clarification I need to make is that there are some people when they see somebody who is struggling with losing weight or who is overweight or obese, they think that the person lacks willpower to stick to some dietary regimen, to stick to some exercise regimen. In other words, the person is not disciplined enough to eat right and to exercise right. That is not true. Okay, there are some of those people have really tried. So I will advise you to refrain from judging people who are overweight or who are obese. Okay, and that brings me to the causes of being overweight or obese, because the impression is that it's all about diet and exercise, lifestyle. Yes, it is true that an important cause or a major cause for being overweight or obese is that your energy intake is higher than your expenditure. There's a mismatch between the calories you take, the calories you use. So if you take in more calories and you use less, the rest will be stored as fat. Yes, we know that. But another reason why people gain weight is because of genetics. That people gain weight because in their family, they have genes, okay, that can make them gain weight. Then there are medications. There are people who are taking that can make them gain weight. All right, okay. I don't like mentioning medications names because when a doctor gives you a medication, it's because the benefits outweighs all risks that the medication will pose to you. So I assume that whatever medication you put on, the risks, the benefits and risks have been considered. Okay, but there are medications that can make you put on weight, and there are medical conditions that can make you put on weight. They alter your hormones, by the Cushing syndrome, the hypothyroidism. There are medical conditions. What I'm saying is that when we see somebody who is overweight and obese, who is struggling to lose weight, let's not conclude this person is not disciplined with diet and exercise. Okay, so what are the various management modalities available to us for those who want to lose weight? Yes, lifestyle modification. We have weight loss medications, and then we have also weight loss surgeries, what we call bariatric or metabolic surgeries. Okay, when it comes to lifestyle, for instance, we know so much about some of these things. I've done a video on what you need to eat, for instance. I've encouraged people to adopt the Mediterranean diet. So basically, there is a guide as to what to eat, although the dietitian can help you personalize it to your situation. What a dietitian will do is that the dietitian will take a dietary history and then know your calories that you take, okay, and then try to help you make some modifications and can help you lose weight. When it comes to exercise, the same. I have a video that I've done on what exercise modalities to go in for, okay? Now, when it comes to the weight loss medications, we are very skeptical because there are only very few approved medications. And even these medications must be given by qualified medical practitioners. So if you have come across several products out there suggesting that they can help you reduce your weight, most of them can be scams, okay? And when they say they are natural products, that even makes it worse because the things that we call natural products may not be any better than the food we eat, or the supplements we take. They are just like the foods we eat, all right? And they don't have any property to cure some disease or manage some problem, okay? If you take carrots, if you take it whole, it is vegetable. If you blend it, it's still vegetable. So there are people that who blend vegetables and think that because they are not taking whole or in form of a salad, and then they are blended into like a juice or into a concoction, then it becomes medicine. You should know better that that is not the case, okay? The ingredients don't change. I mean, the nutrients don't change, okay? So there are weight loss medications that are meant to help you reduce weight. Some reduce your appetite for food. Some help you to not to absorb certain nutrients, especially fats or calories. Reduce the absorption of fat in the intestine. There are weight loss surgeries, also we call bariatric surgeries. So if exercise fails, diet and exercise fails, medications fail, and then we have to consider surgery, weight loss surgeries. But the weight loss surgery, there are indications for them. It means that we don't do it for everybody. Okay, we have to make sure that you really need it because surgery can come with complications. So there must be indications. It used to be that if you are 40, your BMI is 40 and above, it can be considered for weight loss surgery. BMI of 40 is very high, isn't it? Or 35 and above with some comorbidities, that is some other diseases like hypertension, diabetes, or heart disease, and so on. Yes, but these days they have relaxed the indications a bit. So even with weights of BMI of 35 and above, it can be considered for weight loss surgery. or 30 and above with this comorbidities or metabolic syndrome, you can be considered for weight loss surgeries. Okay, so you have to know that there are medications available, yes, but most of the medications may not be approved by the appropriate bodies for use. And some are just products on the market. They are not going to do anything in the long run. And even medications that are given in proper practice is supposed to be combined with your lifestyle modification. Even the surgeries that are done are combined with your lifestyle modification. So don't hit to this promise that you don't need to engage in exercise or diet and some medication or some surgery will do the trick for you. That will be some kind of deception. Okay? So thank you very much for watching this video. Subscribe to my channel. Thank you.